It is so important to find time to reflect at the moment, and I know how difficult it can be to find that time. But we are here with this opportunity to gather together and remember, pay our respects to those we have lost and support one another. I am pleased that you have been able to join us today. We are here on the 11th of March to mark a year since the World Health Organization declared a global pandemic. A year since COVID-19 entered the public consciousness and impacted on us in ways we couldn't have imagined. And not just for a month or two, but for over a year now, you have been working under immense pressure. This is an unprecedented challenge, unlike anything our generation have worked through before. And I've heard from you about the toll it has taken on each and every one of you, both personally and professionally. Many of you feel exhausted and anxious because of what you've been working through. The relentless pressure, that is unsustainable. You've worked on the front line throughout the pandemic at enormous personal risk. And sadly, too many of our colleagues have paid the ultimate price and lost their lives. I want you to know that I hear your anxieties and concerns, and I carry them with me. Many of you have said you want to leave nursing, a profession you love, because you feel overworked, underpaid, and undervalued. It is a terrible position to find yourself in, but you carry on. And you carry on because of your dedication to nursing, to your colleagues, and to those you care for. I've always been proud to be a nurse, but I have never felt more pride in our profession than this year and last year. We have been pushed to the limit, but COVID-19 has brought out the best in us. We have worked together as a team, working with a common goal and going above and beyond. And it has demonstrated to those outside of nursing what it means to work in our profession. Our dedication to patient care, how we lead teams, make complex decisions to diagnose and treat patients. Our work in research, innovation, influence in practice. How nursing is fundamental to patient safety. And the power of the voice of nursing. We have led the COVID-19 response, and we continue to lead through the vaccination programme as it is being rolled out. Whether we've been working directly in the front line with COVID-19 positive patients, or whether we continue to deliver health and care services in communities or care homes across the country, nursing staff in every setting and every role in every corner of the UK have played a leading role in the response to this pandemic. We have spoken truth to power every day when we advocate for our patients and when we speak about our experience in the workplace. And we will continue to lead because this is what nursing is and does. As health and care service leaders start to think about the return to normal service after COVID-19, we will make sure that the nursing voice is heard and is leading those discussions. We are here today to reflect on the year past, but also to come together and reflect on the tragic loss of colleagues to COVID-19. And every week we hear the news that more healthcare workers have lost their lives. Every single death recorded during the pandemic is a sad loss for a family or a friend, but it is a tragedy when someone has died caring for others. Nursing support workers, nurses, midwives, nursing students, or our healthcare workers from other professions. I know I speak for us all here today when I say our thoughts are with the families and friends of every single member of the nursing community who have lost their lives during this pandemic. We will hold a minute's silence at 11 o'clock to remember those we have lost, reflect on the past year, and consider the immense contribution we have made.
I'm so proud of everything our profession has done this year. How nursing staff have stepped up to the mark, making superhuman efforts to make this incredible pandemic something that we have been challenged by, but which we will not be defeated by. The nursing response to COVID-19 has demonstrated, above all, the exquisite skill, expertise, and complexity of the knowledge that our profession deploys in everyday decision-making. It has made nursing visible as never before to politicians and the public, giving them new insights into what nursing staff have to contend with and do every day. Our profession is familiar with managing and often excelling and exceeding expectations, even our own, in a crisis. We lead from the front in situations of challenge and difficulty. We troubleshoot, we problem solve, we find ways to get treatment to patients and deliver care as effectively as possible. Nursing staff have demonstrated, above all, they are leaders as well as partners and practitioners in healthcare. And this has been clear for all to see. And it's never more forcibly expressed or represented than in a pandemic. Strangely, Spanish flu, SARS, MERS, Ebola, the early days of HIV, bring out the best in our profession. Why? Because often these are periods of great uncertainty, panic, fear, anxiety, all meld into one, because we just don't know often what it is that we're actually confronting. And that's the moment when, in the absence of effective therapeutics, what do we have to fall back on? We fall back on the very fundamentals of nursing care, because that is what gets patients through. What we're seeing from research is just how innovative you've been, how creative you have been in choreographing new ways of delivering and managing and organising care. New ways of communicating and forging those links virtually between patients and their loved ones when they can't visit. When you can't feel that human touch from those you love around you, especially at your hour of need. We've been trying to find these different ways to help people talk, to help people connect, and sometimes say their last words to their loved ones. Nurses have been at the forefront of developing these technologies under the most adverse and pressured of circumstances. We've cared not just for patients and done this as equitably as possible, but also patients' loved ones. Everyone has been included, and now we're trying to switch on those services which have had to take a bit of a back seat, and we're ramping those up as we move into a different phase, we hope, of the pandemic itself. That is over and above rolling out and launching and supporting the largest global vaccination programme within the shortest, most compressed timeframe this world has ever seen. This is such a moment in our history. And you are leading from the front, doing all of this simultaneously. It is such an awesome and magnificent achievement. I have a sense of how difficult this year's been for you and for all members. And I just want to share my huge, huge thanks to you for all that you have done, and to do so from the bottom of my heart. Thank you for continuing to do all you do for patients and for our colleagues.
This year has been more of a challenge than any of us could ever have imagined. It's taken a huge toll on us, both personally and professionally. None of us have been unaffected by the pain of the last year, and almost all of us have lost friends, colleagues, and loved ones to this awful pandemic. And before reflecting on that, I wanted to assure you that the RCN is here for you through these tough times. The staff and the elected members are doing all that we can to support members and the wider nursing family. We've been working hard to provide you with the best evidence to support your practice and deliver vital professional resources to support your work with COVID and get the vaccination programme rolled out. We've been consistent in our demands for all of you to have access to credible and safe PPE, and we've supported your refusal to treat if you don't have access to the PPE you need. We've supported you during redeployments, and we've provided you with the tools and guidance on how to raise concerns with your employer. And we've raised concerns on your behalf at every level, with employers, with governments on a number of issues, including increasing patient to nurse ratios in intensive care units. And we've continued to lead work that's so important to you and our profession, such as pay and safe staffing in the NHS and in the independent sector. We've kept the impact of staffing shortages very high on the agenda and in the public through the media, and we've raised this specifically during the pandemic as the impact of nursing shortages has been so keenly felt. And we will continue to influence and lobby government through our UK Staffing for Safe and Effective Care campaign. It's been such a sad year for all of us. Each of us has now likely experienced the death of a patient, the death of a colleague, death of a friend, or the death of a loved one through COVID. And we feel each loss very deeply and very personally. We feel the collective loss of all those who've died because of the virus. Over 800 healthcare workers have died in the last year. And every single one of those deaths leaves a family broken, leaves a team shattered, and leaves loved ones and family members to their own individual grief. I can't really get my head around 800 deaths. It's just too big a number. And so I wanted to talk about one of my friends and a dear member of the RCN family who lost their life this year, Brian Wilson. Many of you will know Brian, particularly those of you who are active in Wales. But I first met Brian 38 years ago because, strangely enough, he was the father of one of my best friends at school. And I remember his surprise bumping into me at his my first RCN Congress. He'd been going for years. He didn't know I was going into nursing. And since then, I've been to 27 congresses, and every congress, one of the highlights for me would be catching up with Brian over a coffee or a glass of wine. He'd let me know how Bridget and Ian were doing, and we'd have a really good catch up. And as well as being a passionate advocate of nursing, and he was a very regular speaker at Congress, he was one of those really kind, gentle people who would help and support anyone who needed it. And many of his acts of kindness and support were done very, very quietly with no fanfare, and were only ever known to a handful of RCN members. But over the years, there were hundreds and hundreds of members who'd been helped and supported by Brian, often in very quiet ways. And for years, he'd been gently lobbying me about reintroducing lifetime membership for members, so that we could give free membership to people who've given a lifetime of service to the RCN. And when we voted this through at council only a few months ago, I was really looking forward to telling Brian in person at the next Congress. It was one of the things I was most looking forward to when we all finally get back together. And it's unbearably sad to know that I won't ever be able to do that. And we won't be able to share a laugh or a smile again. And I know there'll be times where it feels like we're struggling with the weight of all of this loss alone. And I wanted you to know that your council and everyone here at the RCN is behind you. Our staff are behind you. Our elected representatives are behind you. The whole RCN is behind you. And we're with you through this terrible, terrible crisis. And we'll continue to be your voice and support you through the difficult times ahead. And I'd like to finish by offering my own personal thanks to every single RCN member and every member of the nursing community for your resilience, for your commitment, for your continued support for each other, and particularly for the care that you're providing. I very much hope that you can find some support and some comfort in our event today. Thank you for joining us.
Hi, I'm Julie Lambert. I've been a staff nurse for 25 years, predominantly in theatre. I'm currently senior charge nurse in maternity theatre, and I've been in that role for 2 years. I'm also an RCN rep, which I've been for 10 years, and also health and safety rep. And at the moment, I am currently chair of RCN Scotland board. So working during this pandemic, at the start we felt we had plenty of time to prepare for this and get all organised, especially in theatre. We had different ways of working with PPE requirements, so that was quite stressful, but it was good that we had time. However, working within a maternity setting, it was really business as usual because babies keep coming. Second time with the second wave, it certainly felt more stressful this time as the sickness absence. We've had people self-isolating, seem to be taking more of a pressure on services at this time, and I can feel that staff are now beginning to be burnt out because people have done so many extra hours, extra shifts, and they're exhausted now, and they really do need a rest. I think looking at the nursing profession in all health and care settings, everyone has really pulled together and supported one another. It has been stressful because people they've had no option but to work out with their comfort zone. They've mostly had help from the colleagues in other areas to get them through this, and I think it's shown how adaptive the nursing profession can be and what a valued role it is within the health and care settings. So we need to reflect on this last year and learn from it. It's shown how adaptive the nursing profession is, but it's also shown, I suppose, gaps in people and having people skilled and able to work and support in other areas. People have stepped up, which has been great, but it has shown that there probably is a gap in looking at people being able to work and adapt in different areas. We've managed to do things quickly, but it's highlighted more than ever the need for safe staffing, and we can't go back. We need to keep looking forward and fighting for to have safe staffing in place and the value of nursing, and to fight for fair pay for nursing. So looking forward to the future, we need to nursing need to use their voices, because we have got a strong voice. We're a huge part of the health and care workforce. So we've shown that we've been able to stand together to get through this pandemic, and we need to stand together to fight for the value of nursing and for safe staffing. I think for the future, I think we need to look towards our nurses of the future and what we can do to support our student nurses so that they get the best training and they come out as nurses for the future with a strong voice. So I just want to say, as Chair of RCN Scotland Board, I want to thank you all for all that you've done over the past year, and to let you know, as a board, we absolutely understand the pressures, anxieties and the sadness that some of you have all faced. Nobody's been in this alone. I know that I have found the support of the RCN really helpful during these challenges times, and I want to remind you that the RCN is there to support you, and please reach out if you do need that support, because there will be somebody there to support you. So thank you everyone, and please stay safe.
Like lots of people, it's been a double impact because I've lost family to COVID, and at the same time I've lost colleagues to COVID. When the pandemic first started, I was working in a different role which had taken me away from the front line. But like many colleagues, there was a need for people like myself to get back onto that front line because we were so short of staff and there were so many patients that needed help. I think it's important to reflect, not just to think about all those that we have lost, the great sadness that we feel. I think it's also important to reflect on what went wrong and what we could have done differently, why things went wrong and what was wrong about the existing system. But we need to look back at all of those and then look forward so that we're not in the same situation. We need to develop policies which will address the shortages of staff, which was so chronic and which meant that the existing staff had to work themselves to the bone and they still are, to deal with this pandemic. We need to actually not just be sad, but also be proud. RCN members have been at the forefront of dealing with this pandemic. We've shown great courage. We've stood when we were called. And even though there was a great danger to ourselves, we didn't shy away from what the country needed. We were there when we were called for, and we still are. And nurses are working incredibly hard at the moment. And my message to members is that stick with it, be proud of what you've done, and let's move forward and make the changes so that never again do we have to suffer the chronic conditions that we've had to during this pandemic.
I've been a registered nurse now for just 41 years, so quite a varied experience. Background is surgical nursing, and then I'm into clinical nurse specialist, and then I'm in practice education within intervention radiology. Also work in the community setting as a community nurse, looking after individuals in their home, caring for them, and keeping them out of hospital and as well as they can be, and what treatments are required. Obviously, the COVID has brought on major challenges for us all within the profession, and it's been quite difficult initially. A lot of it was fear from everybody, from our peers, our colleagues and the patients, because it was an unknown entity and we weren't quite sure initially how it was spread. So we were very uncertain and trying to portray confidence into the public who you were looking after, that they were going to be safe because they were vulnerable and they didn't want to have anything else on top of that. So that had its challenges, and worried for ourselves, was this contagious as they were saying it was? What was going to happen to us? We were taking it home to our families. A lot of us have children, elderly parents. So the big impact was, how can I keep safe for myself, for the patients, but again for a family? So that was really difficult, especially in the first days when there was shortages of the PPE. It's still quite difficult because there's no great roadmap, still under restrictions. but we have more knowledge now how the virus works. We now have the vaccine coming in, so that's making a big difference. People feel a bit more relaxed. They see a light at the end of the tunnel. I think we've adapted very quickly in the pandemic, having to find new ways to work, having to look at how what we do, is it right, can we change it? A lot of it for the good. Some of it is new to lots of people, but I think hopefully that we can move forward and learn from what we have mobilised very quickly, what works well and what needs to be refined and adapted so that we can be safe, and looking at how do we empower people to look after their own health. It has made us stronger, has made us realise that we work very well and we can adapt to whatever is thrown at us.
I've been fortunate. The home that I was working in and the one I'm working in currently have been primarily COVID-free. It hasn't meant that I haven't been scared, because I have been. Hasn't meant that I've been stressed, because I have been. It just means that my residents have been safe. I've listened to my colleagues. I've broken my heart with my colleagues. I can't believe what they've gone through when I'm sitting listening to them. I wish it wasn't over the phone. I wish that I could just go and give them a hug. It's been devastating, absolutely devastating in the care home industry. And as much as it's been a COVID-free environment that I've been in, it's still been very worrying. You're thinking about the residents and how you can keep them safe. You've been having changing guidelines. You could go off for a day off and then you get your guidelines changed when you come back in relation to infection control. You're trying to keep your family safe. It's so important to reflect. It means it gives us time to think about what has happened, what we did, what we perceived that we did, but we didn't. I suppose what I was trying to say is it means that we can put some distance between what happened and what is happening. It means that we can, talk to each other, support each other, but also have knowledge that we might not think that we've done well, but we have done. As nurses in care homes, we have done so well in protecting our residents and our families and in keeping them safe. And it's only when we reflect that we realise that that is what we've done. We've been so scared and so concentrating on keeping people safe that we've not thought that we have done.
My name's Hilary Nelson. My background is as an ICU nurse, and I've worked in ICU for around about, it'll be 25 years this year. And I'm also an RCN steward and a health and safety rep. So during the pandemic, I have had the opportunity to work both with my team in intensive care and carry on with my staff side duties as a steward. So I've been really fortunate in that I've worked alongside my colleagues during some really tough times, and being part of all the challenges that we faced with, the introduction of PPE, different ways of working, looking after patients with COVID, transforming our department into COVID areas and non-COVID areas. seeing the impact that this virus has had on patients and how we care for them, supporting staff to be able to do that. And we've had some, really happy times where we've had, really positive results with patients and seeing patients recover from this. And then there's also been some really sad times where patients haven't recovered, and been able to support each other in a way that allows us to continue coming to work on a daily basis. This last year has put nursing into the spotlight like no other. And I think that coming together as a group, we need to reflect on our achievements, what went well, what didn't go so well, to remember the colleagues that have succumbed to the virus and how we see our profession progressing in the future. We've come through this as a profession, and demonstrated the power that nursing has, and what it contributes to healthcare. And I think that we absolutely need to come together now to move our profession onwards and what we want for nursing in the future. And I think that for the future, I'd like to see the nursing voice become stronger. We've all been very much in the public eye, and I think that I would like to see continued growth of the public understanding of what nursing is, what the contribution is, and how best to value that, because it should be a valued profession. Sometimes people don't feel valued, but I'd like to see in the future that nursing is respected, that it's valued, that the contribution that we make to healthcare does not go unnoticed, and that individuals who dedicate themselves to nursing and the care of others are absolutely respected in the way that they absolutely deserve.
Hello, my name is Susan Aikenhead and I am the Director for RCN Scotland. Today, I would first like to thank our members who have shared their personal reflections on what has been the most difficult year for our profession, for our colleagues, for those we care for, and for our own families and friends, many of whom have had to pick up the pieces when nurses returned home, having given their all. Whether from working in hospitals, within the community, looking after the vulnerable in care homes, or the huge number of other places that nurses have provided care over the last year. I'm very conscious that I'm stating the obvious when I say that we continue to work and live in very challenging times. And I suppose that we could also say that we're working and living in highly historically significant times too. However, I do fully recognise that this can often seem quite inconsequential when you're actually right bang in the centre of it all and dealing with the daily stresses and strains that these times bring. That is why today I would also like to thank and recognise the excellent work that has been undertaken and achieved by RCN Scotland members, as well as taking some time to think about those who we have lost, those you have cared for, and those you have worked alongside. I've seen the vitally important work that the RCN has undertaken over the pandemic so far, and I am exceptionally proud to be part of the team working to continue to help represent the interests of nursing across all sectors. I know many of you will have had both heartbreaking moments and heartwarming moments, and that these will remain with you throughout your nursing career. Many of you will have experienced this terrible illness yourself and may still be battling with the ongoing symptoms. Thank you to those of you who have already shared your experiences through the SenseMaker tool, and I would encourage other colleagues to take the time to share your own experiences too. Your lived experience is helping to inform our work to support you and to influence on your behalf. Equally as important, it is forming a historical record of nursing and the brilliant nursing leadership and practice during these challenging times. As thoughts turn to recovery and remobilisation for Scotland's health and care services, I know there's still some bumpy times ahead. However, there are many opportunities for us to continue to position our leadership across the country and the areas of practice where you work, to ensure the voice of nursing is strong to affect change for those we care for and our profession. I would like to thank you for joining us today, for taking the time to pause and connect with colleagues across the UK, as we remember those who have lost their lives and those who have lost their loved ones. Thank you.
Ladies and gentlemen, I cannot help feeling that this opportunity to speak to you all as nurses throughout this country could only be a hopelessly inadequate attempt to thank you more than I and so many others can ever say for your truly remarkable achievements during what can only be described as this interminable and most dreadful pandemic. Over the past year, you have quite rightly been in the forefront of the public's mind, even as you have been on the front line of our marvellous National Health Service. Not for nothing have you been described as the heroines and heroes of the hour. And I suspect that it is not widely understood, for instance, that many nurses have had to step outside their normal roles into completely unfamiliar settings in order to help deal with this pandemic. Not only ward and outpatient nurses going into critical care, but also paediatric nurses looking after adult COVID patients. Of course, The same is true for the whole NHS team, where consultant surgeons have been finding themselves working as healthcare assistants in critical care, pharmacists starting work at 0400 to prepare vaccines, and physiotherapists working as ward nurses. In more ways than one, so many different healthcare professions have been responding heroically to the unprecedented demands. Above all, I know you have gone far, far beyond the call of duty, and for much longer than would have been thought possible. In so doing, you have been an immense credit to the nursing profession and an unforgettable inspiration to our country as a whole, particularly as I am only too aware that you have had to face the kind of soul-destroying traumas and challenges that most of us can hardly imagine. As a result, the toll on your reserves of inner strength and your physical and mental endurance must be more draining and often heartbreaking than those of us outside the health service can ever comprehend. This is why, as we approach a year since the start of this long and unbearably grueling campaign, I just wanted to take a moment to say how very special you are, how lucky we are to have you, and how deeply appreciated is the work you do. Your vital, utterly selfless contribution in saving lives and providing the highest standards of care and compassion should never be taken for granted. I've heard innumerable, profoundly moving stories of nurses responding with dedication and commitment under the most impossible of relentless circumstances right across the health service, from treating very sick patients in specialist hospital units to providing care and advice as district nurses, as health visitors, midwives, school nurses, and as GP practice nurses. Many of you, I realise, are extending yourselves still further with your involvement in the vaccine programme, which requires ever more hours of your time and ever more skills, patience, and what must seem at times to be the last remnants of human capacity to explain why vaccination is so necessary. The COVID virus is a formidable adversary, but due to your extraordinary efforts, it has more than met its match. Every day you have gone the extra mile to prevent illness, to relieve pain and suffering, to provide advice, care, and human kindness where they are most needed. Your work has been totally invaluable. The debt, therefore, we owe you all is quite simply incalculable. And on behalf of all those whom you have helped and those whom you will help in future, thank you for everything you mean to us.
We have now come to the end of our event. Thank you for joining us and taking time to reflect on the past 12 months. I would now like to invite you to join me in a minute's silence to remember the members of the nursing community we have lost to COVID-19. Thank you.